Are you suffering from arrhythmia? Here are the top 5 natural remedies for arrhythmia that helped thousands of people relieve cardiac arrhythmia symptoms. Before the use of these herbal remedies, consult with your doctor. Hawthorn berry for arrhythmia. Hawthorn or Crataegus species is one of the most valued herbs for the heart. Studies showed that extracts of this plant are effective in reducing symptoms of arrhythmia, angina attacks, as well as in lowering blood pressure and serum cholesterol levels. Another study from 2008 Cochrane collaboration meta-analysis concluded that there is evidence of benefits in symptoms control in treating chronic heart failure with hawthorn. Hawthorn is one of the most used herbs for diseases of the heart, such as arrhythmia, congestive heart failure, chest pain, and blood pressure problems. It is also great for high cholesterol and for lowering fats in the liver and the aorta. Studies are confirming that hawthorn may be an alternative treatment medication for arrhythmias induced by digoxin toxicity in humans. Garlic for arrhythmia. There is reliable evidence that the more garlic you eat, the less likely you become ill from heart disease or vascular disease. It's proven that it lowers blood pressure and cholesterol levels and prevents the formation of plaque and blood clots in the arteries. Aged garlic is one of the best cures for the heart. There are thousands of different types of aged garlic. It is recommended to eat at least 3 strokes of garlic a week, or even more if there is a high risk of heart diseases in your family. I suggest eating 1 to 2 strokes of garlic per day. Prevention is better than cure. If you decide to eat raw garlic, finely chop 1 to 3 garlic strokes a day and leave it for 10 minutes on room temperature before eating it, allowing to develop the enzyme reaction and the biologically active ingredients. Turmeric for arrhythmia. Turmeric contains a yellow pigment ingredient known as curcumin, a compound that has been a subject of many studies with positive conclusions. Curcumin is one of the most studied compounds on Earth. It has been proven that curcumin balances the level of cholesterol and protects from the harmful effects of free radicals. Laboratory studies showed that curcumin lowers blood pressure and reduces the ability of cholesterol to form plaques on the walls of the artery. Turmeric has been used for more than 3,000 years as a powerful anti-inflammatory agent. Hundreds of studies are confirming its anti-inflammatory, antioxidant, anticarcinogenic, antithrombotic, and cardiovascular protective effects. Department of Medicine, Faculty of Medicine, Chiang Mai University, Chiang Mai, Thailand published a review the protective role of curcumin in cardiovascular diseases, which showed that anti-inflammatory effects of curcumin may have the possibility of preventing arrhythmias. It also has a positive impact on other cardiovascular diseases, such as cardiac hypertrophy and heart failure. Curcumin may prevent diabetic cardiovascular complications, attenuate adriamycin-induced cardiotoxicity, as well as it may protect against the pathological changes occurring with atherosclerosis. Gypsywort for arrhythmia. Gypsywort, or Lycopus europaeus, is a perennial herb which grows primarily in wetland areas. It has been used for thousands of years in traditional medicine to treat arrhythmia, cardiovascular conditions, and many other health problems. Gypsywort has antiphlogistic, cardiac depressant, diuretic, astringent, hemostatic, emmenagogue, narcotic, sedative, nervine, stimulant and tonic properties. In a study published in 2008, researchers revealed that preparations of gypsywort have positive effects on improving symptoms of arrhythmia and increased heart rate as a result of improper thyroid function. Motherwort for arrhythmia. Motherwort, or Leonorus cardiaca, has a long history of use in Asian and European traditional medicine. Traditional medicine uses it for nervous and functional cardiac disorders, as well as for other health concerning problems, such as uterine infection. Beneficial effects of motherwort are known since the 15th century. Nowadays studies are confirming its traditional use as a promising natural remedy for arrhythmia patients. Motherwort is highly valued for its cardiotonic, hypertensive and sedative pharmacological effects which contribute to the overall improvement of heart health and relief of arrhythmia symptoms. Due to its cardiotonic properties is able to correct the heart action in various heart problems. It is also great for relaxing blood vessels and blood pressure as well as for the exhausted nervous system. Motherwort is truly a wonder herb for a healthy heart.